I brought a few pairs of shoes for you to have a look at, and I'd like you to tell us what we should perhaps look for when we're buying a pair of shoes.
Sure.
Well, Doctor, let's start off with a pointed toe pump.
Sure. The first thing we look at is the toe box. The toe box is this area of the shoe right here, and as you said, this is a pointed shoe. Unfortunately, most of our patients and most women, forefoot, or the area between the first and the pinky toe, is fairly wide, and to squeeze in your toes into a pointy toe shoe, you can imagine what happens. Those toes start to point in, and you're going through deformations that are really not unnatural, but still we're forcing our foot in there. So I think this is the type of shoe that we don't necessarily recommend. However, if you wear it for 1 or 2 hours a day, that's not going to make a big difference to you. This is a fairly large heel, greater than 2 inches, and anything over 2 inches we don't necessarily recommend, because the higher that the heel goes, the more pressure is put on the ball of the foot right here, and then the toes get crunched up and squeezed, and that leads to hammer toe formations and all other deformities of the foot. So when we wear pointed toe shoes or inappropriate shoes, there are several pressure points that we have to watch out for. One pressure point is on the side of the foot right here. The second one is right there, and again, these are bony enlargements. There's not much padding in this area, so there's 2 of them here and there. Then we have pressure points on top of the toes, again, right over the bony prominences right here, anywhere from the second through the 5th toe, right in this area. And what you have to understand is when we're squeezing our foot into a shoe that's a little bit smaller and narrower, these bony prominences get irritated by the constant friction during walking. And this constant friction is what develops irritation and then subsequently pain.
Okay, now what about a round toe pump?
A round toe pump is, from the toe box standpoint, is a much better shoe because it fits the contour of your toes much better. So from that regard, it doesn't squeeze your toes and you have more room, therefore it doesn't contribute to the bunion formation or the hammer toe formation. But again, if you look onto to the heel, it's still a fairly large heel, high heel, 2 inches or greater, something that we don't necessarily recommend to use for 6 to 8 hours a day. The other areas that we look for bony prominent, pressure points are going to be the ball of the foot. This is considered the ball of the foot. It's from the 1st metatarsal to the 5th metatarsal. And if you can imagine somebody wearing a high heel, most of the pressure is being placed right on the ball of the foot. The longer you wear the heel, the more you pound on the ball of the foot in this area, the thicker the tissue is going to get, and the more calluses are going to form right in here. And this is very common.
Let's talk about peep toes.
Starting with the toe box, the peep toe, you have this little opening here, and all the toes, all 5 toes, are trying to get in through that opening. And again, we're facing the same type of problem as we did with the pointy toe shoe. It's trying to squeeze all those toes into the center position, and that potentially leads to a deformation of the toes. I do like the heel. It's a little bit shorter, still a little high, but a little bit shorter than the previous shoe models that we've seen. Open heel. What I recommend to my patients, and when they have an open heel, there's a lot more problems with dryness of the heels and fissuring, and especially in the colder months during the winter, we have a lot of patients coming in that wear open heel, and they have the fissures and the cracking that tends to give them a lot of pain. The next part is the heel. For the women who wear sling-back shoes or open heel shoes, you're going to have a lot of dryness in the heel, right around the periphery, maybe even in the bottom. This will eventually lead to heel fissures, cracking, and will eventually get to the bleeding areas, which will cause significant pain. In regards to treatment, we always recommend that the patients wear closed heel shoe, put a lot of moisturizers on, use pumice stones after a shower to get the thickened keratin layer off, and do that repeatedly in order to keep the skin moisturized, much like you see in this patient here.
What do you think about the wedge?
The wedge is an interesting shoe, but what it incorporates is this wider heel and this wedge that you see that goes right into the forefoot area here. It spreads the pressure. There's a lot more pressure redistribution on the entire arch and heel of the foot. So the more we can redistribute the pressure, the less pressure you have on the ball of the foot and then on the heel. So it's a much better functioning shoe, if you will, much more comfortable, and I think out of all these shoes, this is probably the most, I would say, anatomically appropriate shoe.